Gibson Bale is a dedicated medical worker. He has been at the forefront of managing infectious diseases for the past 3 years. But Gibson's life changed after 2 of his colleagues died after contracting the Sudan Ebola virus from a patient.
The workload was heavy, and even when we started the Ebola management, we were working 24 hours. So you have no time to rest. It deprived us of our families. Personally, from September to the end of December, I never met my family, and it was something psychosocial pain.
Following the outbreak in September, more than 140 people in 9 districts contracted the virus. 55 of them died. In response, health teams enforced contact tracing, and the government implemented a 2-month lockdown in the 2 epicenter districts of Mubende and Kasanda, with no new cases reported. After 2 incubation cycles of 21 days each, health workers and the public breathed a sigh of relief.
Having registered no new Ebola case, despite sustained intense surveillance, both at the epicenter districts and nationally, I now confirm that all transmission chains have been fully interrupted, and take this opportunity to declare that the outbreak is over and Uganda is now free of active Ebola transmission.
Not long ago, the Ebola treatment unit at this hospital was categorized as a red zone, bustling with health workers regularly checking on patients in isolation. It has now been thoroughly disinfected and closed down. Uganda has now managed to successfully contain 7 Ebola outbreaks in just over 2 decades.
The global community is learning a lot from this success. This success is not only of Uganda, it's a global success, and the global health community will learn and follow Uganda so that Ebola is not as scary, Ebola is not as devastating as we used to know it.
The government says it has spent $6 million to train health workers and set up 320 beds in treatment and isolation units, thereby achieving this milestone within 4 months. While the country celebrates, 3,600 medical officers and community task force teams remain on standby should this situation change. Darren Alan Cheyune, Africa Matters, Mubende, Central Uganda.